Good morning, ma'am. Good morning, sir. My name is Jole and Manlulu from BSN 11H, and today I am going to perform the assessment of the abdomen. And prior to performing the procedure, I must check the doctor's order for the need to perform the procedure. So, stated in the doctor's order, the nurse must perform the assessment of the abdomen at 1 p.m. The patient is sensitive to cold temperature. The reason why we are going to read the doctor's order is in order for us to be guided during the assessment. And after that, we are going to perform hand hygiene and wear gloves afterwards. And observe infection prevention procedure. Now that we already perform hand hygiene and wear our gloves and observe infection prevention, we must now prepare the needed equipments that are needed for this procedure. So today I have with me my alcohol for sanitation, the gloves, stethoscope, the patient's gown over there. I place it over there for the meantime. And I also prepared the bed for the patient later on. Now that the materials and the equipments are now set, I must now introduce myself and verify the client's identity using the agency protocol and explain to the client on how he or she can participate during the procedure, especially the need to assume the several position for this procedure. So, good morning, sir. My name is Jole. I'm Manlulu from Davao Doctors College. Your student nurse for today. May I know your name, sir?
My name is Iane Manlulu,
Okay. Sir, may I know your birthday, sir?
October 30, 1996.
Okay. Lastly, sir, may I check your wristband, sir? Now that we have verified the identity of the client using the agency protocol, we must now ask the client to empty their bladder for the meantime. So, sir, kanang pwede na manghihitadaan, sir, before na magsugod, sir, kay para dili ta malanganin sa procedure, sir, ba? Para diretso na ta. Okay na, sir? Sige. While the patient is in the bathroom, we must now ensure that the room temperature is warm. And when the patient arrives, we must ask him to remove their clothes and wear the patient's gown. So we must also assist the client on wearing the patient's gown in order for them to be more feel at ease and somehow be more comfortable with it. And now we are done with that. We must now ask the client to now that the client already wore their patient's gown, we must now assist them in the bed in a supine position. So sir, tignan sa daan, sir. And we must now place the patient's hand across their chest. And then place a pillow under the patient's head. And then we must also slightly flex the knees of the patient and place a pillow underneath it. So, sir. Now that we are done with the assessing of the abdomen, we must now proceed with the inspection of the abdomen. And the first thing we need to do is to inspect for skin integrity, coloration of the skin, vascularity, abdominal pain, any striae, scars, lesion, or rashes. If such things are present in the abdomen of the patient, that may be an indication that there is an abnormality. and as what I have assessed, there are no such presence of the like, no scars, lesions, rashes, or any discoloration found. Next is inspect abdomen for contour and symmetry. A normal findings of this is that the abdomen of the patient must be flat or rounded. So we're going to stand at the side and inspect. As you can see, there are no signs of burrowing or bulging of the stomach or bulging of the abdomen of the patient, which indicates that the patient is normal. Next is to observe for abdominal contour while standing at the side of the patient. So we're going to stand at the side, and we must make sure that the abdomen of the patient must be symmetric. If not, that may be an indication that that is not normal. As I am going to inspect it, as I was expecting it, there are no signs of any um, asymmetric, the asymmetry in the abdomen of the patient. Next is to ask the patient to take a deep breath and to hold it. One way of knowing that the patient is normal is that there are no enlargement of the liver of the or the spleen as he is going to do it. So sir, ingat lagi lalong sir ha. Sige. Sige po sir. As the patient was holding his breath or taking a deep breath, there are no signs of any enlargement of the liver or the stomach. Next is to inspect abdominal movement when the client breathes, observe aortic pulsation and peristaltic wave. The presence of these things are normal, and if there are any absence, that may be an indication that the patient may be suffering from something. So, sir, hinga lang ta sir, hinga lang stop lang sir. Sige sir, hinga lang sir. Sir. Inhale. Exhale. Okay. There are presence of the movement of the stomach or the abdomen of the client, and there are aortic pulsations present in the abdomen as well. Next is to assess the symmetry of the contour standing at the foot of the bed. So I'm going to stand here. And it is a normal indication when the patient's abdomen is symmetric. So standing here. As you can see, there are no asymmetric findings in the abdomen of the patient as I was standing here at the foot of the bed. The next step would be observe the abdominal movements associated with peristalsis or aortic pulsation. So sir, dito lang ako sir ha. As the patient breathes normally, there are signs of peristalsis in the client's abdomen, which is normal. And if there are no movements in the abdomen of the client, there is an indication that there is an abnormality present within. And next, we must inspect for the vascular pattern. And one thing of knowing that it is normal is that there are no signs of any vascular pattern. So sir, sige lang sir. Sige lang sir ha. The movement of the abdomen of the client is normal and there are no vascular patterns visible as the movement of the abdomen of the client is in the normal state. Now we are going to perform the auscultation of the abdomen. And we are going to do is to auscultate the abdomen for bowel sounds, vascular sounds, peritoneal friction rubs. And first we are going to do is to warm our hands and then warm our stethoscope. The reason why we are going to warm our hands and warm our stethoscope or the diaphragm of the stethoscope is to avoid the contraction of muscles in the abdomen of the client. As for the bowel sounds, we must use the flat disc of the diaphragm, an indication that the bowel sound is normal if there are, or if we hear about the vowel sounds clearly. So the first thing we need to do is to use the flat disc diaphragm. Yes, sir. Then we must ask the client when did he last eat his meal. So sir, when ka last nag-count, sir? So the louder the vowel, if the patient eats longer or shortly after the meal, there's an indication that the vowel sounds is more stronger than it is normal. But it is normal if the vowel sounds may increase its volume normally. So next is to place the stat in each four quadrants. So there are four quadrants in the abdomen: the lower left quadrant, the lower right quadrant, the upper left quadrant, and the upper right quadrant. We're going to auscultate if there are any presence of vowel sounds around the four quadrants. Listen for the vowel sounds. The irregular sounds occur every 5 to 20 seconds. As what I've heard, or what's what I have heard from the auscultation, there are presence of vowel sounds in the quadrants of the client. As for the vascular sound, we must place the bell of the stethoscope over the aortic, renal arteries, iliac arteries, and the femoral arteries, and listen for bruits. If there are any signs of bruits present as I am going to auscultate the abdomen of the client, that is an indication that it is abnormal. Aortic, or the aorta, the renal arteries, the iliac arteries, and the femoral arteries, As I was auscultating for the vascular sounds of the client's abdomen, there are no presence of bruit as I was placing the stethoscope over the aorta, the renal arteries, the iliac arteries, and the femoral arteries. Next is we are going to auscultate for the peritoneal friction rub. The sound of the friction rub is like two leathers rubbing against each other caused by inflammation, infection, or abnormal growths in the abdomen of the client. As what I have auscultated from the abdomen of the client, there are no presence of peritoneal friction rub, which indicates that the patient's abdomen is normal. Now we must perform the percussion of the abdomen, and the thing we must do first is to percuss several areas in each of the four quadrants to determine the presence of tympani and dullness, and must use a symmetric pattern. So if there is a tympani sound, that may indicate that it is normal, and if it has a deep or dull sound, it indicates that it is abnormal in the abdomen of the client. So we are going to do a symmetric pattern, which will start here, going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13. Now I must percuss the 13 sites with 13 areas that I have shown in the video earlier. Starting from here. Sir, ano ko sa kailan, sir? There are no signs of any dullness in the abdomen of the client, and the only sounds that I have heard is the tympanic sound. Now I must percuss the liver and begin at the right lower quadrant of the midclavicular line and percuss upwards. Note the changes of the sound from tympanic to dullness. So we're going to start here and percuss it upwards. There is a change of sound from tympanic to dullness is because of the liver, and the liver sound is ought to be dull. Next, we must percuss the spleen by starting at the left midclavicular line and percuss downwards. Note the change of the lung resonance to splenic dullness. So we are going to start at the left midclavicular line, repeat here. Then we must percuss it downwards and note the change from lung resonance to splenic dullness. There is a change of the sound from tympanic to dullness in the spleen area, which indicates that there are no abnormalities present or there are no findings that may somehow occur or distort the health of the patient. The next thing we're going to do is to perform blunt percussion on the liver. Percuss the liver by placing the left hand at the lower right anterior rib cage and strike it with the ulnar side of the hand, creating a fist. What we are looking here for is the dull sound of the liver. So we'll place it here and strike with the other hand, creating a fist. There is a dull sound present in the liver area. It's because of the fluid that are present in that area. Now we are going to perform the palpation of the abdomen, and the first thing we need to do on this is to instruct the client to sit with his back to you and perform blunt percussion on the kidneys located at the costovertebral angles over the 12th rib. So what we are going to do is to place our left hand in the side of where the kidney is and strike it with the other hand, creating a fist. The reason why we are doing this is that in order for us to identify if there are any tenderness present in the kidneys of the client or any pain felt. Naisakit, sir, wala?
Wala.
Okay.
Di ada ba nagkidney dahil?
So there are no tenderness or pain as what I have assessed at the site of the kidney of the client. Next, we must place the patient back in a supine position and perform light palpation over the quadrants of the abdomen using the fingertips in a dipping motion at 1 centimeter, and gently move the fingers to the next area. So we are going to palpate starting from here, slowly at 1 centimeter, in order to detect if there are any abnormalities such as tenderness or any abnormal growth present in the client's abdomen. As we are doing light palpation, it is an indication, or it is a big help for us in order to deter if there are any muscle guarding present in the abdomen area. And we must also make sure that the position of the client is somehow to be okay and not at at ease. It must be at ease at all in order to avoid muscle contraction. As you can see, there are no tenderness or no pain felt from the client as I was palpating or doing the light palpation of the abdomen area. Now we must percuss the spleen of the client. And the first thing you need to do is to stand at the right side of the client and reach over the abdomen with your left arm. And place your hand under the posterior lower ribs and pull up gently. So we're going to perform this first. Then place the right hand below the left costal margin with fingers pointing towards the head. This one. And then we're going to ask the client to inhale and press inward and upward as he provides support with the other hand. So sir, tingnan sir ha. 1, 2, 3. Sige sir, tingnan sir. Walay sakit sir pag dot na sir, walay na ano, sa walay gibati. So as I was palpating the spleen of the client, there are no signs of any tenderness and there are no pain that's been felt from the client as well. Now we must palpate the kidneys of the client. And to palpate the kidney, support the flank with your left hand and place your right hand at the right upper quadrant just below the costal margin at the midclavicular line. So we're going to turn the client first the other side, and I was supporting using my left hand. So sir. Then after that, and to capture the kidney, I must ask the client to inhale and then press my fingers deeply during the peak. So, sir, you inhale sir. Sige. Inhale sir. Hold down. Next, that we have felt the kidney, we must ask the patient to exhale and hold the breath briefly. So sir, exhale sir. Inhale, exhale sir. Okay. And release gradually the pressure of your fingers. And then you will feel that the kidney is slipping from your hand. And then next is to do the left kidney and do the other side or the other kidney with the same procedure. So, sir. Yeah. Now we are going to palpate the urinary bladder at the symphysis pubis from upwards towards downwards. It must not be palpable and it must not have any indication for urinary retention. So we are going to palpate starting here towards downwards. Make sure that there are no pain or any tenderness present. Sir, sakit sir? Wala. So as I was palpating the symphysis pubis of the client or the urinary bladder of the client, it is not palpable and there are no signs of any tenderness or any signs for urinary retention at all. Now we are going to perform the test for ascites. And the first step that we are going to do, or the first test that we are going to do, is a test for shifting dullness. So we must first to ensure that the client is in a supine position and percuss the flanks upward from the sides. And then, as we are going to percuss, we must note the change of dullness to tympani and mark the point. So we're going to start percussing here. In this area, we can hear that there is a tympani sound, or the change of the sound, of course, around this area. Next, we must now have the client to turn into sides. So sir, tagilid to sir ha. Yes, sir. Dual gamay dito, sir. And then percuss the abdomen from the bed upwards and mark the level where the dongus changes to tympani. So here. So in this area, this is the location or the site wherein there is a change of sound occurred in this area. So the next test that we are going to do is the test for fluid wave or the fluid wave test. And first thing we need to do is to ensure that the client is in a supine position and ask him to place their ulnar side of the forearm firmly at the midline of the abdomen. So sir, pwede ito paano mo kamot surgery sa tumatawag sa mga position sa area. Okay. Duta gamay sir ha. Then after that, we are going to place the ulnar surface or the palmar surface rather of the hand and the fingers on the opposite side of the abdominal wall of the client. So here, since my hands and my fingers are now placed, I'm going to use the other hand to tap the opposite side of the abdominal wall. The client seems to be healthy and there are no abnormalities found in the client's abdomen as I have done the fluid wave test. So the next test that we're going to perform is the test for appendicitis or the peritoneal irritation. And now we must assess for the rebound tenderness of it. And we must palpate deeply at 90 degrees into the abdomen halfway between the umbilicus and the interior iliac. So sir, mag-apply ko pressure dito sir ha. Sakit, sir? Sakit, sir? Then we must observe the reaction or the expression of the client if there are any pain felt. And ask him what hurts more, the pressing in or the releasing of the pressure. And in what area of the abdomen does the pain felt? Wala, sir. Okay, gibat isa sakit, sir? Wala. So there is no pain felt as I was assessing for the appendix of the client. And then there are no abnormalities present at all. So the next test that we are going to perform is the SOA sign test or the SOAS test. The first thing we need to do is to ask the client to lie on the side. Sir, tingnan na pa sideboard sir ha. Tapos ano lang. Then if the client is positioned, we must hyperextend the leg or the right leg of the client. So sir, iato ni ano sa stretcher pataas. Sa stretcher. Okay, sige balik. Wala yung bati sakit diri na sir? Wala, okay. After that, we must make sure that the patient is back to its supine position. The rationale on why we must perform the SOAS test is because it is important to identify if there is any pain felt if the right leg is hyperextended. And if there are any pain located in the right lower quadrant, there is a tendency that the patient's appendix is inflamed. Now we are going to perform the obturator sign or the obturator test. And then the first thing we are going to do is to support the leg of the client. So, sir, I'm going to raise this one, sir. Support the knee of the client, or the right knee and ankle of the client. And then flex the hip and knee. And rotate it gradually. If there are any pain felt. If there is any extended obturator present, that may irritate the appendix, causing the appendicitis. So sir, wala yung sakit sir? Wala na sakit yung mga lumanda sir sila may appendix? Wala. Okay. Since there is no extended obturator present while I was moving the leg around, there is no sign of any obturator or any appendicitis present at all. Now that we are done assessing for the obturator sign, we must now perform the hypersensitivity test. After ensuring that the patient is in a supine position or a neutral position, stroke the abdomen with a sharp object or grasp the fold of skin with the thumb and index finger and quickly let go. So, sir, let me know, sir, if kanang asa bandang naisakit, sir, ha? Sige. Do this several times along the abdominal wall. Note for complaints or pain exaggerated. Wala sakit, sir? Okay, thank you. Now that we are done with the hypersensitivity test, we must now proceed to the test for cholecystitis. And the first thing that we are going to do first is to press the fingertips under the liver border at the right costal margin. Located in this area. And then, ask the patient to inhale deeply. So, sir, hinga, sir. Sakit, sir. Sakit, sir. Wala. Okay, sir. Isa pa, sir. So if there are any pain that are complaints from the client, we must take note on which area that the pain was felt. And since there are no pain that was felt, then that is an indication that the client's liver is normal. Next is the palpation of the bladder. Palpate the area above the pubic symphysis if the client's history indicates or show possible urinary retention. So we're going to start from here. Sakit, sir? Wala. Sakit. Wala. So there are no signs or history of urinary retention coming from the client. And then after that, we are going to inform the client that the assessment is done and show gratitude to him for his cooperation. And make sure before leaving the room, we must also ensure that the client is in a stable condition before we must leave the room. And after that, we are going to perform hand hygiene. And if there are any findings that were stated earlier, we must record it and show it to the healthcare provider for further more assessment.